As Congress debates whether to infuse between $2 and $5 billion in healthcare's infrastructure, many experts point to the Indiana Health Information Exchange as the working model for a national medical records program.
The key thing that we bring, I think, is on-the-ground practical experience, having done that for quite a number of years now, knowing what works, what doesn't work, where some of the hidden barriers are that need to be overcome in order to be successful.
Hey, what is your private insurance carrier, please?
It was designed in a way to help physicians take care of patients. A lot of so-called electronic medical records that are out there were really designed for administrative functions.
Patient Pamela Sue Perry agrees.
I think you just have to imagine how this is going to eventually expand so it's across all networks, across all states, so that wherever a patient goes, it's going to be easy for their physicians to make some critical decisions about giving them care.
Also, according to the Information Technology and Innovation Foundation, investing in the health information technology industry will create 212,000 new jobs.
One of the wonderful things I think about healthcare information technology and trying to fix our healthcare system in that sense is we get in the short term real job creation to solve these very immediate needs, and in the longer term we create an environment in which we as a nation, as an economy, are more competitive on a worldwide basis. So in the short term there's a win, in the long term there's an even bigger win.
Opponents of the implementation of these infrastructures are concerned about patient privacy. But Dr. Virginia Kane from the Indiana Health Department is sure all information is safeguarded.
The institutionals and the different partners that we are working with have been in the business for a long time of safeguarding health information data, and we recognize how important that is for the public to have trust in this product. So we make it a very major priority for us that those safeguards are in place.
While the debate continues, the Indiana Health Information Exchange claims to be already producing better patient outcomes, a more informed and effective and affordable healthcare system.
From the patient's perspective, to have their information available and be able to share that amongst the caregivers that they use, wherever they're at. It could be here in Indiana, it could be in New York, it could be in Florida, and to begin to coordinate that.
And that is the aspect that as a patient, Pamela Sue Perry likes best about this program.
It was a relief to me because I didn't have to be the one that was schlepping the charts from one place to another or being a go-between to convey messages. I think it makes me feel a lot more comfortable because I know that as soon as the information's available, they can access it.
Could investing $2 to $5 billion in this infrastructure lead to a $450 billion in savings? If so, how long will it take to get those results? Should this be the first step to a healthcare reform? Or should there be other priorities, like more affordable health insurance?
Well, it's clear that the Obama administration believes that this is a key element towards the necessary health reform. But as you saw in that piece, there are a lot of claims for it. Suddenly, it sounds like a silver bullet. It's going to cure all the problems, and it's going to lead to all of these wonderful outcomes. Congressman, you'll have to deal with that in the House Energy Committee, Commerce and Energy Committee. What do you think?
I think it's an essential part and a component of a larger approach to how we're going to reform health care availability, affordability, accessibility, and quality in the United States. But it is going to be essential. So I don't want people to think that it is the one answer that will take care of everything, but I don't see how we'll be able to accomplish the necessary reforms without health information technology.
There are a lot of questions. Some of the claims for this, for example, that it will create 212,000 jobs. That's a lot of jobs. Dennis, as chairman of the Health Division for SSEIU, you're responsible for a lot of workers who would work in these hospitals and medical settings. Do you believe those figures, that it would create that many jobs?
I don't know about that. Okay. I know that we, like Congressman said, we really need this technology. If you have walked to a hospital and, like I have, and see literally millions of records that nobody can find, that is completely wasted. When you see, on the other hand, hospitals that have right at the bedside, where they are basically putting the prescriptions and the notes to for the nurses, so that way eliminates when the nurses don't read accurately the doctor's handwriting and commit medical errors. So we can solve medical errors. We can provide to the patients adequate information about their records. We need this technology. I agree with the congressman. We cannot afford. As a matter of fact, if we go to an auto park and we basically ask for a piece that for your car, they can look it in your computer. You can go to a hospital and look for your medical records. They gotta send somebody to the basement to try to find it. We need this technology.
Greg, what do you think about that? I mean, there have been issues raised, among them the question of the possible issues relating to patient privacy. Mm-hmm. Is that one of your concerns?
It is one of my concerns, but I think they have done certain things through the provisions in the stimulus whereby they spent $19 billion, and part of that is assurance that patients' rights will be protected. What I'm more concerned about is how this is being sold. I believe that the proposal is overly simplistic and it's unsubstantiated, and that this is not a critical part of the solution. While there are benefits of health information technology, I think there are real costs. In no way should we believe that it'll save $450 billion or even $80 billion a year. The Independent Congressional Budget Office has said it'll save roughly $2.2 billion a year 10 years from now. So this is something that, it isn't proven yet. In fact, where it has been used, it hasn't really been associated with reduced costs or improved quality. So it isn't about just subsidizing providers through carrots and then having a stick to penalize them when they don't adopt the technology. It's about how you use this tool and how it fits into a broader health system reform. So I would argue that while this could have benefits, they are right now being overstated, and it isn't enough.